Hello everyone. Welcome today again. A warm welcome to LinkedIn Live today, and we also welcome our viewers on YouTube as well as Facebook. And also, I would like to welcome our guests on Instagram also. So, welcome everyone. I am Dr. Mohan Rao. I am a practicing gynecologist and clinical reproductive immunologist. We have our centers, Dr. Raut Centers for Reproductive Immunology, and at these centers, we treat couples with unexplained repeated miscarriages, recurrent IVF failures, and unexplained infertility using immunomodulatory treatments. The mainstay of our treatment is lymphocyte immunization therapy. And we have our centers across India. Our main center is in Mumbai, and our other centers are in Pune, Nagpur, Delhi, Hyderabad, and Bangalore. A few more centers are in pipeline. And as I said, lymphocyte immunization therapy is the main treatment that we provide at these centers. All of you know that lymphocyte immunization therapy, or LIT, it's an active immunomodulatory treatment which is useful for couples who have unexplained repeated miscarriages, unexplained recurrent IVF failures, and unexplained infertility. Now, the way we do the lymphocyte immunization therapy at our center is very unique. And this is a patented process, and it is branded as ImmuLIT or ImmuLit. So today, I am going to discuss one interesting part of this treatment, and that is the different myths and misconceptions that are associated with lymphocyte immunization therapy. Whenever we talk to our patients, they always come with some queries, some doubts, and they ask these questions on a regular basis. And over last so many years, we have realized that there are certain doubts which the couples always have in mind, not only patients, but the doctors who refer us patients also have these queries. So let us today discuss these myths or misconceptions. Actually, when we announced this program, I was going to discuss 20 myths. But today, in today's consultation, I came across 5 more misconceptions and myths that I came across from today's consultation, and I have included those myths also. So let us begin with this interesting part of myths and misconceptions. So the first and the most important myth you can say, or misconception that you can say, mainly with our doctor friends, is that lymphocyte immunization therapy is an experimental treatment. Now, it is very important to understand the meaning of this statement. Whenever a treatment is explained as, or it is called as experimental, it is the method of research that is used to know the success of that method. So there are different types of research methods, you all know. So there is something called as experimental research method. So this is of two types: true experimental and quasi experimental. And experimental method means that there are two groups or two sets of patients. One group is given the treatment, the other group is not given the treatment, and you assess the efficacy or success of that treatment modality or medication, whatever is the thing that is to be tested. Now, the true experimental research is when one group is given the treatment, other group is given a placebo, that is something which is not the real treatment. While in certain conditions, it is not possible to randomize the patients like this, by some are given therapy and some are not, and especially these are the patients who have multiple miscarriages or IVF failures, because these are the patients who are not willing to go into the control group. And so for these patients, the efficacy of any therapy is decided by what is called as quasi experimental research study, where the randomization of the treatment is not possible. So when LIT is called as an experimental treatment, this is not a trial and error or just to see whether it will work or not. And it is the method by which the research is conducted, because LIT is an established treatment. It has been in use for more than 3 decades, and there are centers across world who are doing this. So therefore, lymphocyte immunization therapy is not an experimental treatment, but its efficacy has been proved by experimental research methods. Okay, so this was the first. The second misconception or other myth that is usually associated with LIT is whether it is efficacious or effective. Certain doctors say that lymphocyte immunization therapy is not effective. It has not shown success at all. But in reality, if you discuss with those who have been doing this treatment globally, they will agree with you, or they will tell you that lymphocyte immunization therapy is an effective treatment for couples who have this unexplained reproductive failures. There are studies from 90 till date who have shown the efficacy or the success rate of lymphocyte immunization therapy to be 75 to between 75 to 85% for properly selected couples by doing the immunological tests. There are meta-analysis of research studies. So analysis of these studies have shown that the odds ratio or the chances of success in patients who have been treated with lymphocyte immunization therapy is almost 3 to 4 times more than those who have not been given lymphocyte immunization therapy. So you will understand from this that lymphocyte immunization therapy is effective, and we have been in this field for more than 30 years. In our center for almost more than 10 years, more than 3,000 LITs we have given, and the success rate is close to 80% in our patients. So it is an effective treatment. The third misconception or the myth is that LIT is risky. LIT can be harmful. Now, this is a very loosely used term, and if you actually follow the patients who have taken lymphocyte immunization therapy and the babies, it is shown that lymphocyte immunization therapy is one of the safest treatment. Maybe it is even safer than the passive immunomodulatory medicines like the immunoglobulin or the intralipid or steroids that is used. So it is not at all a risky treatment. Yes, it is an immunological treatment. It acts on the immune system, but it does not cause anaphylaxis, like severe allergic reaction, or no long-term complications like the autoimmunity or even graft versus host disease. So LIT treatment is not risky at all. The next myth is lymphocyte immunization therapy cannot be given in pregnancy. It has to be given only in non-pregnant state. Yes, LIT is usually given in non-pregnant state, but if the couple presents with pregnancy and there is history of say multiple miscarriages which are unexplained, and the reports indicate that the couple will be benefited by lymphocyte immunization therapy, then lymphocyte immunization therapy can be given during pregnancy. Again, there are studies and meta-analysis which have proved this fact, and there are meta-analysis by Liu and Cavalcante which have shown that the lymphocyte immunization therapy is beneficial when given before as well as during pregnancy, and it does not have any harmful effect on pregnancy. It does not lead to intrauterine growth retardation or IUGR. It does not lead to preterm deliveries. There are no harmful effects on the mother or the baby. Okay, so it can be good. In fact, we have a series of patients whom we have treated during pregnancy when they presented in pregnancy. Some of these patients were presented with threatened abortion. One patient was sent from a hospital in ambulance to give this treatment, and subsequently they have done well. So it can be given safely in pregnancy. The next question usually asked by patients, and rightly so. So they ask whether will lymphocyte immunization therapy or LIT will decrease my immunity, or will it cause immunosuppression? Now, here I would like to tell you one important fact that lymphocyte immunization therapy does not suppress the immunity. That is one. And why so? Because just to explain, the immune system has two parts, the protective part and the destructive part, and there is a balance between the two. So the destructive part represents the classical immunity, what we say from in protection from infection, while the protective part of the immunity takes care of the pregnancy and prevents autoimmune reactions or autoimmunity. Now, when we give lymphocyte immunization therapy, we don't have any effect on the destructive part of the immunity or the Th1 immunity or inflammatory immunity, but it acts on the protective part, and we strengthen the protective immunity by increasing the protective antibodies and T regulatory cells. So, therefore, the lymphocyte immunization therapy is not an immunosuppressive treatment, it is an immunomodulatory treatment. Fine. The next myth is it is a corollary to what I would say the experimental treatment. Some doctor friends say this is a trial and error method. You just give and see whether it will work or not. So this is not a trial and error treatment for sure. This is an established treatment because we do immunological investigations like lymphocyte cross-match, NK cells, TNF alpha, endometrial NK cells, antithyroid antibodies to select couples who will be benefited by lymphocyte immunization therapy, and then only it is given. So it's not a trial and error method. It's an established treatment which is in practice in different parts across the globe. The next myth is very commonly our doctor friends ask us, LIT is randomly given to patients. So that is wrong. So it's a misconception. LIT is not for everyone. LIT is not for all patients who have miscarriages, who have IVF failures, or who have infertility. So there is a specific group, or as it is called, a subgroup of patients who can be benefited by lymphocyte immunization therapy, and there is a way to find it out. As I just mentioned, by doing the immunological tests like lymphocyte cross-match, which should be negative, TNF alpha, which can be high, there are certain changes in the natural killer cells, maybe presence of endometrial CD57 cells. So all these factors indicate that there is a chance of immunological problem, and lymphocyte immunization therapy will be beneficial. For example, if the cross-match comes strongly positive, lymphocyte immunization therapy has no role. So that patient cannot be benefited by LIT treatment. So this is not a treatment which is randomly given. So the next myth is LIT has no scientific basis. No, this is absolutely wrong. So in fact, LIT is the most researched and studied immunomodulatory method for as a treatment method for unexplained miscarriages and IVF failures. You must understand this. So have been studies going on from 90s to till date who have shown the efficacy, but the scientific basis comes from the understanding of immunology of pregnancy. All of you know that pregnancy, our body doesn't accept anything which is foreign. The only exception is pregnancy, because pregnancy is immunologically and genetically different from mother. The part which comes from father is different from mother's body. Or sometimes in IVF, where donor egg is used, it is 100% different. But in spite of that, the mother's body accepts this pregnancy as what we call as paradox of pregnancy. So this natural protection of pregnancy that occurs, which is immunologically different, is through certain protective antibodies called as asymmetric antibodies or blocking antibodies, and protective cells called as T regulatory cells. And it is this protection that protects the pregnancy, and lack of protective antibodies or low T regulatory cells have been associated with reproductive failures of different types, miscarriages, IVF failures, or infertility. So finding out about the lack of protective antibodies or low T regulatory cells helps in selecting couples who will be benefited. So LIT has a strong scientific basis on which it acts, the immunological basis, and how the immunological problem can be recovered or treated using lymphocyte immunization therapy. There are studies which have shown that after lymphocyte immunization therapy, the T regulatory cell count increases, the Th17 Treg cell ratio decreases, and the protective antibodies increase, which confirm that LIT is definitely efficacious or has a scientific basis in protecting pregnancy in this selected subgroup of patients. The next, if this has scientific basis, the very commonly asked question, because I have put these myths as I have come across them. Many patients who especially read a lot or Google a lot, or they are from out of India, they say that LIT is banned in US. This is the statement they make. So this is actually a wrong statement. LIT is not practiced in USA. It is on hold. US FDA has put it on hold. In fact, you will be surprised to know that the LIT originated in US. The maximum cases of lymphocyte immunization therapy have been done in United States. So and there in around I think 1999, because of a large study which came from US, that is the REMI study, which showed that LIT is not beneficial. The US FDA wanted more data, more trials to confirm the efficacy of LIT, and it has put it on hold. Actually, we are in touch with the doctors who used to practice LIT in USA. We have also met the doctors who were part of the research study, and these doctors are very keen to restart lymphocyte immunization therapy in US, and they are collecting data, or they are in touch with doctors who are practicing it outside US, and they are also planning to start studies, research projects in US on lymphocyte immunization therapy with doctors who have been practicing it out of US. So therefore, it's not something which is, and of course, the reason why it was stopped is something, this is not the platform to discuss that, and it will not be prudent from my side to tell this in this talk. So that's a subject of entirely different talk. So that is about what is happening in US. Next important, very important myth is LIT is done where, that is done everywhere, different places, is similar. Now, it is very important to understand that the principle of lymphocyte immunization therapy everyone knows. The name suggests use of lymphocytes to produce immunomodulation. And therefore, each center or each doctor performs it in a particular way. But let me tell you, the LIT that is done at different centers is done by different protocols, different methods, and maybe what is done in one center may not be similar to the other center. One simple example I'll tell you, the way we do it at our center is whatever modifications we have done, and we have filed for a patent which is branded, and even we have a copyright in 160 countries about the process. So this particular method is the way we do it is different. We do it as a single sitting. There are centers abroad who you do it in 2 sittings. There are centers which do it in 4 sittings. So therefore, it's not the same, and therefore the results that are seen at different centers are also different. Yes, there is a need to have uniform protocols or uniform investigations, which which the things are in pipeline, and American Society for Reproductive Immunology is doing a lot of work in regularizing the use of reproductive immunology in reproductive failures, and I'm sure definitely positive things will come out of this. The next is next query or question that is raised is LIT is expensive. Sometimes some couples say LIT is very expensive. Now, let me tell you, when any particular price is attached to any particular thing or a treatment or a medicine, the most important part is the value that that treatment is giving, and with respect to that value, what is the price that is there. So yes, LIT itself has different pricings abroad in Indian sittings, but if you see the efficacy or the benefit of LIT, where you can save an IVF cycle, or after multiple IVF failures, if the patient succeeds, after multiple miscarriage, the patient succeeds. So compared to those expenses, definitely LIT is definitely not an expensive treatment. And if you add the value, see the value, then definitely it's a cost effective treatment for uh, those who have reproductive failures. Only those who have gone through this and then they have succeeded after LIT will vouch for it, or will tell you what they had gone through and how their life changed after that. Where the expense part, what they had spent before, you can't compare compared to the what the pricing of LIT. So this is about the price part. The next myth is LIT is not done across the world. We haven't seen anywhere it is being done. So if you don't really research and really find out, then you will not see anywhere. But now lymphocyte immunization therapy is coming up in a big way. There are centers globally. There are centers. There are LITs being done in countries, European countries, Middle East countries, Japan, China, India, Sri Lanka. So there are different countries where lymphocyte immunization therapy is in practice, and so it is not right to say that it is not done across the world. And I'm sure with more and more studies coming up, more and more research projects coming up, the reach of LIT is going to increase and it will be available to more number of patients globally. The next myth is there is no scientific research done in the field of LIT. Absolutely wrong. I just mentioned that it is the most researched and studied method of immunomodulation for couples who have repeated miscarriages. There are studies in 90s, as I said. There are in 1994, I think, or 95, the recurrent miscarriage trialist group, which was part of SHA group, had shown that LIT has beneficial effect. From that, over these years, I think from 95 to 2020, almost there are 30 studies which have shown the efficacy of studies have shown, majority of them have shown efficacy that lymphocyte immunization therapy is beneficial, barring 3-4 studies. So therefore, the thing that there is no scientific research done in LIT is wrong. There are large studies done in Brazil, and there are meta-analysis presented by doctors from Brazil, especially Dr. Barini and Dr. Cavalcante, Dr. Sarno. So they have done huge work in the field of lymphocyte immunization therapy. The next myth is LIT is outdated. So it's very interesting comment. One doctor told me LIT is outdated. It has no role now. Now, see, for anything or any treatment, if something which is not beneficial now and it has been absolutely beneficial over years, the procedure gets modified. There are instances where say for example, when laparoscopy came, they said that now abdominal surgery is outdated, it will not be done at all. But then over years it is now realized that yes, there are certain situations where open surgery is required. So yes, there will be the selection will be important, but the therapy will never be outdated, because something which is showing efficacy will remain all the time. Yes, it will get improved. There will be better ways of doing it, or maybe something altogether different, higher level of the treatment will come up. But yes, it will. It is not an outdated treatment. The next myth is, or the misconception is, how does LIT act? Nobody knows. The mechanism of action is not known. That is absolutely wrong. Now it is an established fact that we know how lymphocyte immunization therapy works. See, when the lymphocytes are injected into the skin, they are picked up by the dendritic cells. They're taken to the secondary lymphoid organs in the body, and they stimulate the T cells, B cells there. And these stimulated cells, then later on, produce the B cells produce antibodies, T cells produce T regulatory cells. And how does this happen? These lymphocytes have a surface marker called as CD200, which has the immunomodulatory effect, fresh lymphocytes. So this CD200 induces these protective antibodies and T regulatory cells, and this same CD200 is present on the uh, fetal side, on the trophoblast. And so similarly, when there is pregnancy, these cells which have been sensitized, they grow further, multiply further, and produce T cells produce more of protective antibodies, and T cells produce T regulatory cells, and thus they protect pregnancy. So it is very clear how lymphocyte immunization therapy works, a scientific basis for it. The next myth is LIT is a simple procedure. What is there in it? You just separate lymphocytes and inject, and the things happen. It is not that simple. It's a complex process. There are different various steps involved in this. There is a permissible or the required concentration of lymphocytes is important. Permissible level of white red blood cells and the platelets should be there in that preparation. If this ratio changes, your effects will go down. So therefore, it's not a simple procedure. It has to be done very carefully. Otherwise, it will lead to complications or side effects. And then people come out, oh, LIT has side effects. But if it is not done the right way, complications can happen. So, as a corollary to this, the next myth that is there, there is no qualification is required to do LIT. This is absolutely wrong. So, of course, you can't tell anyone or rather stop anyone from doing it. But ideally, world over, it is the clinical reproductive immunologists who are who should or who do this immunomodulatory treatments, and it is always advisable that a qualified clinical reproductive immunologist should be involved in doing a immunomodulatory treatment like lymphocyte immunization therapy. I'm happy to share here that, as I think I might have told this before also, that Dr. Mugdha, my wife, and me, we are the only two clinical reproductive immunologists certified by the American Society of Reproductive Immunology among the 36 globally recognized clinical reproductive immunologists with a special fellowship. So it is very important. Yes, if the right people do the treatment, do the procedure, then the results are bound to be good. So therefore, it's not that anyone should do it. The right qualified people should do it. The next query is, it is difficult to, one couple asked that told us, it is difficult to get good LIT treatment. We don't know where we will get good LIT treatment. Maybe I won't say this is a myth. Maybe this might be true also. But it, if you'll have to see the find out more about the center, find out more about the doctors who are giving it, and I think it should not be difficult to get good center to get LIT treatment. Next is, there is no proof of success of LIT. I think I have already told you that there are studies which have shown that the LIT has 75 to 85% success. LIT has adverse effect on baby. Not at all. See, lymphocyte immunization therapy, when given before and after that, when the couple conceives, definitely there is no effect, as I said, on the mother, but also it has no effect on baby. Even if it is given during pregnancy, there are no adverse effects on the baby, because there has been a research study by Dr. Caroline Coulomb, where her study has shown the follow-up of babies. They have shown that there is no increased incidence of hyperbilirubinemia or jaundice in the baby, maybe because of sensitization of of the different blood groups. And second is no increased incidence of thrombocytopenia, because one of the objections was there might be antiplatelet antibodies, and therefore there can be lysis of platelet and thrombocytopenia. But the studies have shown that there is no increased incidence of neonatal hyperbilirubinemia or low platelets. So that way, it is very safe for baby. And these large studies there are large studies like the study of by Kling from Germany, who have followed up these patients. So they have shown no side effects in mother as well as in baby, who were followed up for many years after LIT procedure. So yes, it is safe for baby. The next A myth is very important, especially asked by our IVF colleagues. LIT is not useful in cases where donor gametes are used. For example, a donor sperm is used, or donor embryo is used, or donor egg is used. So here, I would like to tell one very interesting and important thing, that LIT is an immunological treatment. It's not a genetic treatment. So the problem here is lack of immune protection in mother because of lack of protective antibodies. So we can induce these antibodies by using lymphocytes. Now these lymphocytes, which lymphocytes can be used? Any lymphocytes other than the patient's own lymphocytes. That is, they are called as allogenic lymphocytes. So lymphocytes from husband, lymphocyte from any donor who has been tested for infection can be used to induce these antibodies. So therefore, even if there are donor gametes, we can use husband's lymphocytes to induce the protective antibodies, and vice versa is also true. For example, husband cannot give blood. Maybe husband is HbS-Ag positive, and therefore we can't take his blood. Then we can use blood from a fresh blood from a donor who is tested for infection, and cells from his blood will also have the same effect, because the CD200 is present on all lymphocytes, and they will induce the protective antibodies in wife even when it is taken from donor. So this question comes very often, and we have almost met maybe 100 times. I must have told to different doctors that LIT is useful even in presence of donor gametes. One very interesting myth is, one patient said, LIT, is it like a cancer immunotherapy? LIT, yes, LIT is an immunotherapy, but it is absolutely different from a cancer immunotherapy. In fact, it is exactly opposite. In cancer, we don't want the cells to grow. So we want to destroy those cells. While here, we want the cells to be protected, the pregnancy to be protected. Because see, the both the conditions, in pregnancy and in cancer, there are rapidly dividing cells, so which our body detects and builds an immunological response. So, but for pregnancy, it's a protective response, and for cancer, it destroys it. So, in case of cancer immunotherapy, we want the cells to destroy it, while in case of, that is, the T regulatory cells, we don't want T regulatory cells to be there. While in case of protection of pregnancy, we want higher number of T regulatory cells. So this is not a cancer immunotherapy, not similar to it at all, exactly opposite. The next query is, LIT always, or myth is, LIT always requires multiple sittings. So yes, many centers, as I mentioned some time back, that they require more than one sittings, two sittings, four sittings to induce the immune response, while we use only single sitting. So it is not necessary that every this LIT has to have multiple sittings, because it not only acts by producing protective antibodies, but it also acts by inducing T regulatory cells. And see, these after LIT, the mother's T cells and B cells are sensitized or activated, and when they are exposed to pregnancy again, they produce these protective antibodies and T regulatory cells. So there may not be all the time protective antibodies or T regulatory cells immediately after LIT. So therefore, we also do not repeat investigations after LIT, because the response here, if you understand the immunology part, then it is the sensitization of the T and B cells which is important, and subsequently on exposure to pregnancy, these cells multiply and produce the protective response through antibodies and cells. So the next myth is, effect of LIT is lifelong. No. See, lymphocyte immunization therapy has immunomodulatory effect, but it gives this treatment. The effect is only for 18 months, and after that, the effect goes away. And finally, LIT has no future, not at all. I am of the opinion that LIT has absolutely bright future. There will be welcoming changes in the LIT procedure. The time may come where we may not inject cells, but we may inject only the surface antigen to induce the protective antibodies and protective cells. But yes, LIT has bright future, and I am sure in the years to come, it will play an important role in patients who have repeated miscarriages and IVF failures and unexplained infertility. So I think these were the 25 myths which we discussed today. And if you listen to all this, or you can listen to this later on also to this video, all your doubts related to lymphocyte immunization therapy will be clear. And I am sure you will share this with your friends, with your doctor, with your patients, and more number of these patients will be benefited there, as their doubts will be clear and they will be open to the idea of taking lymphocyte immunization therapy as a part of their treatment to be successful and complete their family, or complete or fulfill their dream of having their own baby. Thank you so much for being with me. And I think there are some questions. Is there any age limit to be done for LIT procedure? Yes, the till the time patient has ability to conceive, there is always possibility of efficacy of LIT, because if the patient is say more than 40 or 45, patient may require donor embryo. But if patient has immunological problem, we can give LIT at that age also. So till the time patient can conceive, the has a possibility of conceiving, LIT can be given. So if you have any queries related to this, you can always contact us. Our helpline number is 9833201522, and your queries will be answered. We will include this in our next talk. You can suggest topics for our next live presentation, and we will plan presentations on those topics. Thank you so much for being with us, all my viewers from LinkedIn, YouTube, and Facebook, and so also Instagram this time. Thank you so much and good night.